Okay, since we have also the recording, some of people maybe who are registered will then join to the recording. So maybe we'll start. Okay?
Okay.
Yeah. So once again, hello everybody. Thank you for joining us and welcome to the series of educational webinars from the SIOP GH and Psychosocial Wellbeing Working Group. I'm Alisa Kamalyan from Armenia, co-chairing the group with my colleague Ayushi Kaneja from India. Our Psychosocial Wellbeing Working Group strives to be a platform of connection for psychosocial professionals working worldwide to improve the quality of life for children and their families by promoting a multidisciplinary approach to the psychosocial aspects of pediatric cancer treatment. And one of the ways of achieving this goal are our educational webinars with specialists with different backgrounds. Today's topic is very important as this approach is rarely discussed in pediatric psycho-oncology. So today we'll exploring the Gestalt Therapy and its application to psychosocial oncology. And it's my honor to present our speaker, Gestalt trainer, therapist, and supervisor, Frans Meulmeester from Netherlands, who has over 40 years of experience as Gestalt trainer and therapist. Frans has also worked for 25 years as therapist and counselor at a cancer counseling center for clients with cancer. He is actively involved in developing Gestalt institutes worldwide. Frans is a registered member of the European Association for Gestalt Therapy and Theory as a therapist and supervisor, and he is also a European Certified Psychotherapist with the European Association for Psychotherapy. Dear Frans, thank you for accepting invitation, and please, the floor is yours.
Yes. Okay. Thanks, Alisa. Thanks. Okay, and thanks for introducing me. So yeah, what I like to bring is what Gestalt approach can offer to people who are dealing with cancer or with their family. So the relatives, sometimes partners, sometimes children, sometimes parents. So why do I think that the Gestalt approach, let's say, is a good approach in that sense? It has to do with the roots of the Gestalt approach. One of the roots is the existential phenomenology. And as you can understand, the moment cancer come into the life of people, there's a huge existential issue. Uh, the question for many people, why me? But also, what does it mean to me that this come into my life? And that's exactly one of these basic principles of Gestalt, that Gestalt is supporting people in finding their meaning. In Gestalt, we love to use the word responsibility, but not in the sense of who is responsible and that we want to find the guy who's responsible, but responsibility, we literally mean the ability to give a response to a situation. I think maybe you know this expression. We cannot control what comes to us in our life, but at least we can choose our response to that. And there, I think Gestalt really has something to offer because of this existential phenomenological. Another root that I like to mention, because it's also connected, is the fact that Gestalt also has roots in Zen Buddhism. And that means there is a clear focus on awareness in the here and now. And of course, it doesn't mean that we don't look at the past or we don't look at the future. That is nonsense, because especially people with cancer, they want to make up, let's say, the score of their life. Even when healing is still an option, you want to see for yourself, how was my life so far? How can I give meaning to it? But also when healing is not possible, then for sure People are looking at, okay, what did I do with my life? Maybe you know that, for instance, also Irvin Yalom, in one of his books, says that a lot of fear for dying is actually the fear that I didn't live my life. So here comes again the Gestalt with this existential, but also with the Zen Buddhistic approach. Let's stay with the here now. What is happening here now? So we like to support the awareness. And the third principle that I want to mention is that the Gestalt approach is very relational. And that also connects to the philosophy of Buber about dialogue. As a Gestalt counselor, therapist, we perceive ourselves as equal to our client. Of course, there's a difference in power. We cannot deny that. There's a difference in function. We cannot deny that. So there is an asymmetry, but it's not about that we are not equal to each other. So in this dialogical approach, it's really like Buber says, the I-Thou relation that we try to achieve with the client. So a Gestalt counselor or a therapist will not bring him or herself as an expert, but more like, okay, I'm willing to stand with you, I'm willing to sit with you, I'm willing to walk with you, so to say, and to explore, what does this mean for you? How can I support you in finding meaning, in finding a way in this process? Yeah, I think that is for sure important. Let me quickly look in my notes. Yes. So I mentioned already a couple of times this word awareness. I think most of you will know the word, but still in Gestalt, it's a very basic one. Because Gestalt is not so much focused on change or on results, but it's much more focused on helping the person to get more aware. And in many situations, awareness can lead to change. Not always. This is also a discussion I sometimes have with colleagues, because not every situation can be changed. But again, the change can be that I find another way of dealing with the situation. If I think of the work with cancer patients that I did for so many years, for instance, to accept that you have days that you are sad, or that you have days that you have fear, to stay with that, to accept that these are days, and what does that mean to you? Because there are some approaches where they speak about negative emotions or you should be positive, but I think it's not right. I don't think we support people, because that means they start to judge themselves. Oh, yesterday I had a bad day because I was so afraid. Yes, it was a difficult day, but it doesn't mean that it's a bad day. So this is also a way of creating awareness. What do you feel? What are you going through? And how is it for you? Instead of that I, as the counselor or as a therapist, will tell the patient, the client, how he should deal with the situation. It doesn't mean that we will never advise a person. I can give you a clear example. Many years ago, I had a couple and they came to our center for support because their son, I think he was somewhere 25, 26. He was diagnosed with a form of lung cancer with a very bad prognosis. So they even said, yeah, please people realize this could be a matter of a few months, not even a year. So they came to our center. I remember that this man was asking me, tell us, how can we deal with that? And in that moment, I said, well, I cannot tell you how you can deal with it, but together we can explore how you are dealing with it and if this is helping you. And it was very, how can I say? I can't find the right word, but let's say the next session, the couple came back and the man said, Frans, I'm really a bit pissed off with you. I said, oh, please tell me. He said, well, you told us that you are already doing this work for 15, 20 years. So you know damn well what works and what doesn't work. So you can tell us something. So in that sense, I realized, yes, if we are too strict on not saying a direction or a possible way, then we might also abandon the client. So for me, it was a beautiful lesson. Okay, yes, I can sometimes share what works for people, and then still the client can see, does it work for me or not? So, like I said, the Gestalt approach is mainly helping the person. What is really happening with you? Without denying whatever comes up, if it's fear, if it's sadness, if it's anger. We all know that some people are very angry with the fact that they have the cancer. For me, it's a very natural response to such situation. So to stay with a person, not judging the anger or the reaction, but explore and maybe even help the person to express it. That can also help the person to trust him or herself in her own process. So that is for me very basic to Gestalt, that we are in that sense supporting the person. I'm quickly looking in my note to see if I don't forget anything, what I want to share with you. I think what is important is that, and we all know when you work with people with cancer, again, sometimes there's a positive prognosis of a positive perspective. Yes, there is a treatment. Yes, there is healing. And of course, again, we support the person in, let's say, walking that road. We are close to the person. We stay with the person and help him or her to explore their own emotions, reactions. For sure, also when it's about couples, we in our center, we always invited, how would it be if you bring your partner with you? Sometimes even we were inviting the whole family, or I went to the people at home to sit with the whole family. Again, to see how are you dealing with that? How much can you share with it? And of course, I realize this is very cultural, because I know in some cultures, for instance, I work in Nepal, and there we also speak about dealing with cancer, dealing with dying. I one time had a question from one of my students, Frans, how should I deal with it? Because the family is sitting in one room and the person who's dying sitting in the other room, but he's not included in the conversation about his death. And then I realized that in my country, in the Netherlands, in our culture, yeah, that would normally, let's say, be very strange, because normally we are open, we share together about the situation. So when I'm sitting with a family, I think one of my first focus is how can I support the sharing? How can I support the communication? I've seen many times situations, if it was about a couple, if it was about the whole family, I sometimes use the expression, it looks like islands in the stream. Each is isolated in their own pain, in their own suffering, in their own fear, but there's no sharing. And that makes everyone, or that can make everyone very lonely. So in that sense, when I'm there with the client, of course, but also when there's a couple, when there's a family, then how can we support the sharing, the talking about, even with smaller children? And of course, when there's a family, I remember a situation where there were quite young children. Of course, you don't bring the most terrible scenario from the beginning because you don't know. You can still have hope. It can still change. But at least I think it's very important to include the children because children notice the tension. They notice that something is going on. And if we are not open, the child will make their own fantasies, stories, fears. So for me, this is also, again, part of Gestalt approach. How can we support the sharing? How can we support that children are included in the communication? In our center, we also had someone who was specialized in working with the children. She did, for instance, art therapy as one of the options, but she also had other approaches. But again, we were very much focused on including the children in such a situation. When I look again at what is for me very basic in Gestalt, I remember when I finished my Gestalt training, so that's of course many years ago, at my graduation day, somebody came to me and said, "Are you interested in working with people with cancer?" And for me, it was totally new. I was working in healthcare, but more in nursing homes, a home for old people. So it was for me a surprise that somebody asked me. But when I look back, it brought me so much because many psychotherapy approaches, and Gestalt can also have it, that we are very much focused on techniques, on interventions, on doing something. And the work with the clients, with cancer, but also again, the relatives, it helped me to connect to a very basic element in the Gestalt approach is being present. And I think that all of you know how important it is to be present. As one of my teachers always said, we're not human doings. It's a bit important that we are human beings. So to be present with a client. I remember many sessions really, for sure in the process of dying when I was there with the client, but also in the early stage where a person is totally overwhelmed by the diagnosis. There could be sessions that were, let's say, maybe 60% silence, but not a silence in the sense of emptiness, but a silence of a deep connection where words are actually not even needed because the person feels that I'm with him or her. It's not necessary to put a lot of things in words, but in the silence we can share a lot. I don't know if you know that expression of Mother Teresa. In one of her books, she writes, "In the silence we got." And I myself am not religious, but I like this expression that silence can be so important. And that is for sure something that I learned from the Gestalt, and especially working with Gestalt with people with cancer, to be together in silence, to be present for a person. I remember sometimes sitting on the bed with the client because the client could not come out of the bed. So we also sometimes went to the people at home because when we start the process, in the beginning, they came to our center, but we always had the agreement, if you're not able anymore to come to our center, if you don't live too far away, we will come to your house. So I had many times that I was sitting next to the bed in a hospital or with a person at home, and I noticed how important it is to be present. So that is for me a very important quality of the Gestalt approach. And especially when I think of some of my clients, where this moment comes that they hear from the doctor, yeah, we're sorry, but we have tried everything, but in the moment we don't see any other options. So this shock of that, at least as far as the doctors know in that moment, there's no more treatment possible. I don't like it when a doctor says there's nothing to do anymore, because for me, most of the time, it means that this doctor or this hospital doesn't have any options anymore, but it doesn't mean that there's nothing to do. I remember that one of my clients, she was very realistic. She had a cancer where indeed at one point the doctor said, sorry, we can't do anything for you anymore. It's over, so to say. But she kept on hoping, not denying. It was not denial, for sure not. She kept on hoping, and one day she came to me, she said, Frans, I will not see you anymore because I will go to South America. I know there is a tribe in the Amazon, they have a sort of treatment maybe for me. If it doesn't work, okay, but if I don't try, I will not forgive myself. So again, in such a moment, it's for me supporting the client in her awareness around her choice. I'm not the one to say this is a good choice or not a good choice. But of course, I want to explore with her, is it a sort of denial or is it hope? Where you, for me, the difference is when there's hope, there's also the confrontation with, let's say, with the facts. But next to the facts and next to the information of the doctor, there's still hope that something is possible. My own professor who started the center where I was working, he always said, if you don't believe in miracles, you're not a realist. And I like that expression because we had clients. I had a client, he came to our center and he said, well, I'm diagnosed with a form of blood cancer and they gave me 3 months. So please support us in dealing with this and to prepare, to help me to prepare for my dying. And I used the word funny, it's maybe not right, but the funny thing was that this man lived another 7 years where even the doctors could not find the cancer. And after 7 years, the cancer came back and then he passed away in about 2-3 weeks. But also his wife said, Frans, it's you cannot imagine. He's riding the bicycle as a boy of 16 years old. I cannot get up with him. And he's working in the garden as a teenager. So we could not find a clear reason, but of course it had to do with somehow his attitude, his approach to his own life. And therefore, I think it's so important that we are able to be with a person, support this hope, support person in making choices, even if doctors maybe say, well, this is not realistic. Okay, see, how is it for you? Again, supporting that awareness in making the choice. Because I really think that if I come back to that word responsibility, if a person is very much overwhelmed by the diagnosis of cancer, many clients, and I think you will recognize that, they feel a victim of the situation. Why is this happening to me? And the moment that we can explore with the person how it is, how you can deal with the emotions, giving space, sometimes distract, finding ways to support yourself, then you could see that you come out of this victim position and still see that you have options, that you have maybe not options in the sense of cure, but options in the sense of dealing with the situation. Like I already mentioned, when people are, for instance, protecting each other, I had many times couples where you could notice they do not really go to their emotion because they don't want to be a burden for the partner. But then then you see that they're in some kind of isolation and lonely. So normally when I would see something like that, I would invite them, I would mention it because I see the body language, or I would share my awareness and support them in that sense that they together share, where again they can, I would say, get out of the isolation, get out of the loneliness, and feel it more as this is something we do together. Of course, it's not always possible. I remember one time a client, his wife had referred him to us. She had a couple of years before breast cancer. She was supported by one of my colleagues. She was super satisfied about our center. So when her husband was diagnosed with cancer, she immediately referred him to us. But I remember sitting with him and he was very clear. He said, my wife wants me to go here, but I don't want to think about my cancer. I don't want to talk about my cancer. I know I can die, but I don't want to think about it. I don't want to talk about it. I just want to go to work and do my thing. And I hold the silence for a moment to see what more is coming, but it was clear. The silence was only a pressure for him. So I suggested to him, maybe at least we can have one more session that we invite your wife, that we sit with the three of us to explore what is it that she wants you to come here and how can you deal with it? And it was a very nice session because indeed the wife became aware of how much she was hoping that he would also be cured by going to our center and that he would be more communicative. But it was clear this was not him. He said himself, let me walk with my dogs. That's much better than that I talk about it. So this was a beautiful session where with the Gestalt approach, I could support them in making new choices. She was able to accept that he didn't want to talk about it, and he was able to accept that at least there were a few things that they needed to discuss. For instance, they had their own business, so how should we deal with the business when you die? How can I say to the children, we need to do that together? So there were some basic, and it was beautiful to see how from both sides they respected and accepted each other. And he didn't come back to me because he really didn't want to talk about it. And I understood later from my colleague who was still seeing his wife that yes, he was walking, he was working, and that was his way of dealing with the situation. So in that sense, I don't think that everybody, let's say, is supported by this form of, um, of therapy, what is more verbal. That's why this colleague with art therapy, she also was there, and it helped a lot of people. Let me see what. Yes, to come back to the situation where it's clear that there is no treatment possible anymore, then I think it's so important that we, as counselor or therapist, I prefer the word counselor because we're not dealing with psychopathology. We're dealing with people who are overwhelmed. And for me, that's more counseling. So I like to use the word Gestalt counseling. But in such moment, it's so important that the counselor is willing to stay with the person, that we can bear our own, let's say, in a way, our own pain of not being able to change the situation, but to be with the person. And I think that all of you, because you're all in this work, you all know how important it is when a person feels, I'm not alone in this. Yes, I know I have to walk the road by my own, but not alone. And that's a huge difference. And I think that Gestalt has something to offer there. Finally, what I like to address is that in our center, we also worked a lot with groups. Some groups were very specific. For instance, one of the female colleagues, she was leading a group for women with breast cancer. I one time had a group with men with prostate cancer. So that were very specific groups. But I also had a group, and I did that several times. We called that group Gestalt in Perspective. It was half structured in the sense, in the first sessions, I had some structure around getting the news, around how is it for you? What are your resources? How do you deal with your environment? But let's say from the 10 sessions, after session 4, then I left it more open in the hope that people would start sharing with each other and supporting each other. And most of the time that worked very nice. So I always say that as a group counselor, in the beginning, we are a bit more in the center because we also need to create safety. Because we had sometimes group where a person who was, let's say, um, recovering and picking up their life again. And it could be that he or she was sitting next to a person who said, yeah, the doctor told me I only have a few months. And they were together in the group. And sometimes were difficult. But on the other hand, it was such a beautiful meeting because from both sides they felt supported. So in that sense, in the beginning, I'm a bit more in the center to create safety, to support the communication. But the moment that the group start to pick it up and start to communicate with each other, I can be more a facilitator at the sideline, so to say. And that is for me very important with groups. Most of our groups were, let's say, 10 meetings, and a meeting could be 2.5 hours, and then a weekly meeting of 2.5 hours. That is okay. So this is a bit what I like to share. Do I still have time? I think yes.
Yes, you have some time.
Okay, let me see if I. No, I think I shared the most important. If there are any questions, I would prefer to hear questions, then I can respond to that.
Yeah, well, people are free to put their questions in the chat or
To speak up?
to speak up. Yeah, of course.
Uh-huh.
Well,
Hello.
people are thinking. Okay.
Yes, please.
Yeah, go ahead.
Yeah. Hello. My name is Karishma Pavaskar, and I'm a psycho-oncologist and an expressive arts therapist from Cancer Patients Aid Association, Mumbai, India. I totally relate myself with the approaches that Gestalt has, and I predominantly work with pediatric oncology patients in the public hospitals here. So, when you mention about creative art modalities being one of the ways of reaching them and understanding their emotional distress, is something that I do believe in.
Mhm.
And recently, something that we have started is with conducting support groups for caregivers as well. And like you mentioned about how you first kind of create the space for the group and then kind of get into the facilitation slowly and move to the other role. I wanted to know whether you can give some tips on how do we navigate through as a facilitator when we have to hold like a group of individuals who are caregivers, and what kind of themes do we can also navigate through.
Um, I I can see if I can quickly find it, but let's say for me the first session is about getting to know each other. Huh? Who are you? What kind of cancer are you dealing with? What is your perception, etc. And then the second could be, okay, what are your resources? Where do you find support for yourself? To explore it, but also by listening to each other. That one says, for instance, I go walking with my dog. The other will say, well, I do painting. And to hear, oh, never tried that. Oh, so sharing about our support. Then also, one of the topics is, yeah, how to deal with the doctors, with the hospital situation. Again, sharing, because some people have huge difficulty in communicating with doctors. There's so much looking up to the doctor that they forget their questions or don't ask the questions. And then again, it's nice when they support each other. Oh, most of the time I take my brother with me, or most of the time I write down my questions. I don't need to say that. They can share that. Huh? Other session is indeed, how do you look at the future? What does it bring to you? I always used a lot of drawing in the group sessions, because it's a nice way that people first reflect for themselves. They might make a symbol or a drawing, and then in smaller groups they share it, or we come back in the bigger group. Bigger group, I mean that was most of the time maximum 10 people. That is minimum. I prefer 8, and it can be 12, but let's say between 8 and 12, not more. So that's another way to but also as a topic, how do you deal with your relatives? Where do you find the support? What issues do you encounter in contact with your relatives? So in that sense, like I said in the beginning, I gave some, oh yeah, dealing with fear, for instance. How do you deal with your fear? But then from, let's say, session 4 or 5, I start to ask, what topics would you like to bring today? And then and how is that for others? So then I'm more supporting the communication. When somebody says something or asks something, I don't give the answer. I say, people, how is that for you, this question? How do you deal with that? So to bring it or keep it in the center of the group instead of constantly bringing it to me as the so-called expert. Because I am not an expert. I didn't have cancer. That's clear. Most of us, I can't say all, because I know some people are exactly in this work because they had it. But so, and what is sometimes difficult in a group, and that's why I prefer at least 8 people if possible. Sometimes you have people who are so overwhelmed that they are hardly able to listen to others. They're so much in their own anger or sadness, and then they can dominate the group. I had it one time, that group was only 6 people, and there was one woman, she was struggling with cancer already for 19 years. Each time that she was cured from cancer A, few years later, cancer B showed up. So every time another kind of cancer. So she was so angry with life, with God, whatever. And in that moment, you see, when you have a small group, then there is not enough ground for the others also to find their way in it. So it was for me something. First of all, I said to my colleagues, we really need to do an intake, because some people are not ready to be in a group. They are so much into their own story that it's better to have them in an individual session. than that they are in a group because they're not able to listen to others. And I don't say it as a judgment, but pure, they're so much overwhelmed. That is, so that is a bit about the group. Okay.
Thank
Thank
you.
you
We have
so much for
another.
your. I had
Thank
another
you,
question. Is it okay
Karishma.
if I go ahead with it?
We have another question from Amelia.
Yes.
Then, if we'll have time, Karishma, we'll come back to you. Okay.
And
Yeah,
otherwise,
sure.
we need to have a coffee in Mumbai because I'm regularly in Mumbai.
Oh, that's great. Please drop into our organization.
Emilia, please.
So thank you so much for the great talk, Frans. So my name is Emilia and I'm working for a pharmaceutical company, Merck Healthcare in Darmstadt in Germany. And from background, I'm pediatrician and I'm involved in pediatric studies in oncology. So I think this is the most difficult population for Gestalt therapy. I want to tell you that I'm a member of the Accelerate group where we electronic patient reported outcomes. So we want to develop some tool that we receive a feedback direct from our patients, not from parents, not from caregivers and so on. So I was very impressed from your talk. And I was thinking that most probably your advice how to implement some of the tools of the Gestalt therapy in this interactive, because we are thinking about an interactive electronic like a gaming approach, which will be stratified by different age groups, obviously. So if you can give us some hits, it will be be possible, because as you know, all our patients, their end stage cancer where not other therapies are possible and so on. So I will be very happy if I can provide them with any support with the tools of the Gestalt therapy.
Well, if I understand you well, you want to develop tools that are more electronic because
Yes,
you're
that's
into a
correct.
game.
Yeah.
And in that way, this is of course totally not my area, but what I can imagine, if there's some kind of, let's call it games, what children can play, where they can, with characters, more than one, support communication, support by drawing, support by other ways of creativity, but then of course on the screen, but also by the games connect to others so that you can stimulate sharing among the children.
Yeah.
I don't know where, but I saw it. Maybe Alisa told me about it, or I saw it. That was a connection by online where children were in contact with each other and could share their situation. That, but for the rest, I'm really not an expert on what is possible in the form of games. What we did in our center, especially this one colleague, she used a lot of different kinds of art therapy. And other colleagues in other country, I know they used also this sand table as a tool, because sand tables, playing with puppets in the sand, etc., that can also help to bring emotions to expression. That is so for me, working with children, but for me, Alisa is much more an expert than I am. But for me, working with children means how can we support the child in finding some way to express. That can be by drawing, that can be by other forms of art. And again, how can we support communication? How can we support connection? Because I've seen many times, also in our center, but for sure. I know from Alisa and in workshops that I gave, so many times situations where the child actually knows exactly the situation, but parents, because of protection, do not speak about it with the child. So that's what I said also in the beginning. How can we support sharing, communication, open communication? That is, so if there's some way, let's call it game. I don't like the word game in that sense, but let's use it. If somehow the game can stimulate, support communication with others, sharing, yeah, that would be.
Because, you know, initially there is a such tool which is developed through such type of communication on the shared electronic patient-reported outcomes that the children, they reported some signs and symptoms that can predict adverse events. This was done in a study with the children with the brain tumors. And that is why I just want to implement this for our studies, obviously, and to help as much as possible for the Accelerate working group. Thank you so much.
Okay, you're welcome. You're welcome.
Thank you. Karishma, if you're still here, you can go ahead with your questions that you had. Yeah.
Yeah, so actually, my second question was about children with cancer. They, even as young as like 6 years old or 8 years old, they do have an idea about what is going on. Probably not the proper terms or entirely about what is it and what is cancer, but they do know what they feel. So I've had a lot of conversations when children come up and talk about death and dying and their perception and idea around it. I wanted to know if we had to use Gestalt approach in such cases, how do we kind of navigate through this conversation or counseling session with the children?
As far as my experience, but I also hear from colleagues, for instance, again, drawings. Can you make a drawing of yourself, how you are now? Or can you make a drawing very open? And then we know that whatever drawing the child makes, there is something in it. And we don't go into interpretation, but we ask the child, can you say more about your drawing? Do you want that to say a bit more? But that depends the age. What I love to do with drawings is that you sometimes cover a part of the drawing and ask the person, how is it when I cover this? And what happens if I uncover it again? And that can sometimes also help the child, the adult, to be more aware of, oh yes, this is very essential for me. That can be a person in the family, that can be the dog, that can be a star somewhere in the drawing, that the star represents the hope or the light. So in that way, we call it phenomenologically. I love to work with drawings in a very phenomenological way. And I agree with you, Karishma, that there's a beautiful book of Greg Firth. He worked together with Elisabeth Kubler-Ross, and I think it's called Drawings. So he worked a lot with children with drawings. And it's exactly what you say, that he had experiences that children were making drawings. And in the drawing, it was totally clear that the child was aware of their own perspective, their own situation. That is where the parent thought he doesn't know it, but in the drawing, it was totally clear. So yes, children know more than we think, for sure. That is.
Thank you for sharing so much. And if you can just share the name of the book and the authors in the
Yes,
chat box,
yes,
it will be great.
yes. Otherwise, I sent it to Alisa because I need to see it. I have it somewhere here, but I can share it later in the.
Yeah, you can share it later, and I will put it in our WhatsApp chat.
Good, good.
Thank you
Okay.
so much.
You're welcome. You're welcome.
Thank you. I also have a questions, as you were mentioning about being present, which sometimes seems very easy, but we all know that it is very, very difficult, especially in the hospital busy setting. It's more complicated
Yeah.
to be present. Maybe you would share some tips for the counselors. What could help us to
For
be
sure.
more present?
Well, for sure, the first thing that comes up in me is that I always try to arrange with the department, the nurses, is it possible that I can go with the patient in a separate room? Because being with the patient when there are other patients around, it can block the being together a lot. There's distraction, other people are talking, the patient doesn't feel completely free, etc. So most of the time it was possible that they said, yeah, you can go there, and then they brought the bed, or if the patient still could walk, so that is very important. Also, again, to see, does the patient want to have the family with them in a meeting, or do they prefer to meet me alone? To check it, that we don't go automatically from one or another perspective. That is, of course, also for myself, if I was going to the hospital, that I really take time. Let's say I sit maybe 45 minutes or half an hour with the client. It was not always a full hour, but at least I schedule so much time that I come in calm. I'm not rushing. I come in calm. I can take time for my own centering, I would say. But also when I say goodbye to the patient, that I can really feel, okay, I still have space. I go for a walk, because that also helps me to concentrate, that I know that I have the space, that yeah, and for me, it sounds almost like a cliche, but when I sit with the client to see what helps me to ground, to focus. So sometimes I was sitting on the bed, on the side of the bed. Sometimes I was sitting on a chair, but I need to sit close, because otherwise I get distracted by other sounds. But of course, I check with the patient, how's it for you when I sit here? But I had situations where the patient asked me, can you please come and sit on my bed or hold me? I'm a person who let's say, love physical contact. So I had situations, especially in the hospital or when I went to people at home, but sometimes also in our own center, that the client asked me to hold him or her. So that can also help us to connect more. It's not only in the talking, sometimes holding a hand. But I had one of my most beautiful clients in that sense. He really asked me to sit on the bed, and he asked me, can I put my head in your arms? And I was sitting there, and we didn't talk anymore, because it was really almost a moment of dying. Because when I left the room, I heard from the staff that he just passed away a few minutes later. But to allow yourself to not being the professional, but to be a human being, that is so important. And to see for yourself, what do I need? How can I create conditions for myself that support me to be there as a human being? That is, I hope I'm concrete enough, but yeah.
Yeah, I really love this, that we are not the experts,
Yes.
but
Yes.
we're just
Yes.
can
Because
accompany them.
like I said, and it's not a joke, I am not the expert. I didn't die already. Yeah, maybe in another life, but I don't know that. So I'm not the expert in dying. But for sure, I have experience with being with a person in the process of dying. And that is,
Yeah, and that is the beautiful part of being present. So
yeah,
thank you, Frans, for this, I would say, very, very grounding session. We
okay.
sometimes do lots of theoretical part, but this session was very grounding and about ground awareness and being present and being human. Thank you so much. Thank you, everybody, for joining, and who joined later or couldn't join at all later. We will send you the recording of the session. So follow our mailing to join to our next webinars. And have a nice evening or morning to everybody. Bye-bye.
Thank
Bye-bye.
you. Bye.
Bye. Thank you.
Thank you. Bye-bye.
I will find that book, Alisa. Otherwise, I can send it by email, but maybe I can find it.
Okay, that is great. If you find, you just can share the name.
I have it. Can I put it in the chat, my dear?
Yeah, you can put, if somebody has already left, I will put it in our WhatsApp chat. Yeah. I will copy it and.
Let me see, because I see that here it is Dutch, but original title, The Secret World of Drawings. Oops. Yeah. Okay. This is it.
Okay, great. I will copy it to our WhatsApp chat.
All right.
Thank you. Thank you, Frans.
Okay, my dear.
Bye-bye.
Bye-bye.
Yeah.
Bye-bye.